which has resulted in post-COVID economic impact, and also advocate for cost-effective approaches to workforce development. Ladies and gentlemen, in conclusion, the world we inherit and the world we inhabit is increasingly complex. The challenges such as climate change, political and conflict-related violence, emerging antimicrobial issues, and the threats of escalating antimicrobial resistance, opportunities and challenges in the information technology and revolution, and the need for multi-sectorial collaboration, we all need to confront these realities with confidence and provide evidence. Not only evidence, but evidence-based solution. This forms the basis of our conference theme, Strengthening Health System in Africa towards Enhanced Global Health Security, the role of field epidemiology and laboratory training system. I warmly welcome every single one of you to the 8th AFENET Scientific Conference. Enjoy it. Thank you very much.
Thank you so much, Chairman, for...
Merci beaucoup, Monsieur le Président, d'avoir bien résumé nos pensées et vos idées que vous avez partagées. Mesdames et
messieurs, and important organizations have come here to reaffirm of their commitment. We've been encouraged, we've been challenged, we've also been invited to a lot more opportunities of collaboration. And that is really the spirit of what we'll be experiencing for the next 4 days. But at this point, ladies and gentlemen, I think it is a fantastic point to allow our chief guest to issue us a keynote address as well as to officially open these proceedings. And so, ladies and gentlemen, it is my pleasure to bring to you the Deputy Director General at the Ministry of Health for the Republic of Kenya, Dr. Sultani Matendechero. Karibu sana. Come on, a proper round of applause.
Yeah, thank you very much, Program Director. And let me start by greeting all of you, ladies and gentlemen. Good morning. Yeah, so allow me to stand on the protocols that have been established before me in the interest of time, and probably just go straight to welcoming all of you to Kenya, and specifically to the beautiful city of Mombasa, which is one of the top tourist destinations globally. And I was just having a discussion this morning with some of our colleagues from AFENET, and I said, I think the idea of bringing this conference to Mombasa was a very good one, because it allows us to blend the very important discussions that we want to have with a feeling, you know, a holidaying feeling within this very beautiful city. So I believe that it is not for no reason that this conference is being held in Mombasa for the second time. I think there was something that was experienced the first time, and I'll not be surprised if probably a resolution is passed that, you know, we just decide to be holding these conferences. And when that resolution is passed, then we will be happy to host you every other year in Mombasa. So this 8th AFENET Scientific Conference is a very important event to the Ministry of Health in Kenya, and even to the Africa region in general, and to the world, because we are now at a very interesting time when we speak about public health. And so we are very happy to host it here in Kenya, because we believe that a lot of the discussions that are going to be held in this conference are going to shape a lot of the objectives that, and goals that we want to pursue in addressing our priority public health problems, not just in the Africa region, but globally. We have increasingly realized that health is a very important component of global peace, global security, and even global prosperity in general. And this is epitomized by the experiences we have had recently, when we have had public health emergencies literally grinding everything to a halt, disrupting all the infrastructure and all the other activities that we carry out from day to day. And so, we cannot overemphasize the importance of paying very close attention to our public health priorities for the sake of ensuring that all the other important issues around our peace, our security, and our prosperity are also addressed. So this conference will bring epidemiologists from all over Africa, disease control experts, to discuss best ways for us to prepare and mitigate the adverse effects of public health emergencies, public health issues, to handle public health threats much better, so that we don't keep on having the kind of disruptions that we have experienced in the future. So, ladies and gentlemen, just a few months ago, we had our Africa Climate Week, and we were lucky to host the Africa Climate Summit here in Kenya, but in Nairobi. And during this time, it became very clear that with the increasing globalization and the increasing changes that are happening in the world, our priorities are shifting. Issues around climate change are becoming very important to us as public health practitioners. We can no longer turn a blind eye to the impact of climate change. A lot of discussions were held during the Africa Climate Summit, and they were gearing towards how we can be able to change the challenges into opportunities, the challenges we are facing. And one of the main challenges of climate change is the issue around global warming. So how do we work around ensuring that some of these challenges are actually, we adapt to these challenges and even turn some of them into opportunities? Recently, our meteorological department actually warned us that we are going to experience the El Nino phenomenon. And recently, we have actually seen an elevated amount of rainfall, and we know what comes with that. So we are seeing a situation where there are a lot of casualties with the increased rainfall. We are seeing a lot of disruptions in our public health infrastructure. We are seeing increased prevalence of vector-borne diseases. We are seeing other issues like, an increase in the incidences of diseases. And these are issues which are now coming to confront us because of issues around climate change. So it is very important for us, even as we now start this conference, to be able to give a special attention to issues around climate change. And as we talk about climate change, we also have to remember that it is not just climate change alone. We are also experiencing a very big increase in challenges like antimicrobial resistance, which we also have to pay attention to. We are just emerging out of the COVID-19 pandemic, and we have seen that pandemic preparedness and response is a very important issue that we also have to keep talking about and focusing on. So I just want to really call your attention to the importance of being able to look at a broad-based approach of challenges that are facing our public health systems. About a year ago, a new government came in place here in Kenya. And this government came in with a policy which is based on bottom-up economic transformation. So we have a bottom-up economic transformation agenda. Now, in this bottom-up economic transformation agenda, a very key component is actually the health agenda of the country. So for the very first time, we are now seeing a situation where healthcare is a primary priority of the government. And it goes further, because we are now mainstreaming a bottom-up approach to the way we do things. We as a country have decided that we now want to move away from a predominantly curative, rehabilitative, palliative approach to healthcare, but we want to now put more attention to health promotion and disease prevention. We have been informed, science has informed us. Scientists, like the ones who have filled this room, have informed us that for every shilling we invest in health promotion and disease prevention, sorry, shilling is our dollar here in Kenya. I think you have already interacted with it. So for every shilling we invest in health promotion and disease prevention, we save 9 shillings that would have gone into treatment, rehabilitation, and palliative care. So you can imagine how impactful this kind of policy shift promises to be in terms of long-term return on investment and in terms of efficiency in delivery of public health services. So, in line with that health agenda within our bottom-up economic transformation agenda, 2 weeks ago, we celebrated our Heroes Day. And just to ensure that we are on point, the President himself launched the Universal Health Coverage Program in Kenya. And in the words of the President, which he usually says in Swahili, and I'll try to translate, not into French, but to English, is that whether it goes up or it goes down, left or right, forward or backward, we must deliver universal health coverage to our people. So that it does not matter your economic capability. It does not matter whether you have money or not, but quality healthcare will be available not just to Kenyans, but each and every individual who is within the borders of our country. And this is coming at a time when the President himself has also pronounced himself on the intention to make sure that we do not have any restrictions to Africans who wish to come to Kenya. So, to get visas to come to Kenya. Because historians have told us that Kenya is the cradle of mankind. northern part of Kenya. I was not very good at history, but I think those were the Zinjanthropus and those others. They came from Kenya. And I think that is why when you are here, you just feel like you're at home, isn't it? So the next time you want to come to Kenya, after this, very soon, you will just require to jump onto a plane and then you come home. You don't need visas or any other thing, you just come. And that now really brings us to the realization that we have to ensure that these quality healthcare services that we are providing are capable of handling the very likely increase in the number of people that we are going to be seeing coming to Kenya. So I'll just spend a few minutes maybe talking about this universal health coverage program that we recently launched and we are now implementing. Actually, you will realize that right now there is a lot of activity because we are trying to ensure that we start customizing the issues that are contained in this program. There are a lot of activities going on in Nairobi right now as we speak, regulations being prepared because just before the Heroes' Day, the president signed into law four laws. 4 bills were signed into law just before the launch, just to show how serious and committed we are that we deliver on universal health coverage. So there are 4 pillars that we are looking at when we talk of universal health coverage. And number 1, we are looking at human resources for health. And I am actually putting it in order of priority because it has been realized that for us to deliver universal health coverage, then we must have sufficient workforce and well-trained, skilled workforce. So you can already see how the FETPs, which we call FELTEP in Kenya, are already contributing to our realization of universal health coverage. Okay? So this is a very important conference to us because it directly feeds into realization of the most important pillar, which is universal health, human resources for health. The second one is around healthcare financing. Okay? And we are really looking at the possibility of coming up with a very robust mechanism of ensuring that everybody who needs healthcare is able to get it. So we are remodeling our insurance, our national insurance fund, so that now we have a social health insurance kind of arrangement that is much more robust and receptive to the needs of the country. And then we are also looking at other financing models, long-term sustainability, to ensure that as we move forward, every single person who requires high-quality healthcare is able to get that. The third issue, which again is related to this conference, is around the utilization of information, data and information, to make decisions and to plan. Because we are saying that we are generating a lot of data within our service areas. We are generating a lot of data from research, but then we are not utilizing this data to make decisions and to plan. So we now want to improve the efficiency of our health information systems so that we are much better capable of utilizing this data to make informed decisions. And the main thing that we are going to leverage is digitization and technology. So one of the bills that were actually passed into law 2 weeks ago was on digitization of health services and health information systems. So that is actually the third pillar of our universal health coverage program. And then the fourth one, we also realize that for us to be able to provide healthcare services, then we must make sure that we have the health products and technologies that we need to be able to treat and to manage the conditions that we are faced with. So we are looking at very innovative ways of ensuring that we are able to provide these health products and technologies at an affordable cost. And some of the approaches, some of the strategies that we are looking at relate to things like local manufacturing, so that we can be able to produce these products much more cheaply. I will just say that in our bottom-up approach, when you look at something like human resources for health and focus on health promotion and disease prevention, we have actually deployed 100,000 health, community health promoters. I know in other jurisdictions they are called community health workers, community health volunteers, but for us we are calling them community health promoters. And we are giving them a stipend so that we can enable them to move around and identify the key priorities within the communities. So for every 100 households, these are community health promoters who visits them. We have equipped them with gadgets. We have equipped them with BP machines, thermometers, weighing scales, glucometers, so that they can go around in the households and screen each and every member of the community and pick out some of the public health issues early enough so that they can refer them to the nearest health facility. So that just shows how serious we are in making sure that no one is left behind in this UHC conversation. Now, back to this conference. This year's theme of the conference, and I quote, is strengthening public health systems in Africa towards enhanced global health security. That is a very powerful theme, and especially given the time at which we are having this conference. And it just underscores the urgency and importance of the topics that have been lined up for discussion in this particular conference. Today, we are really looking at very many processes. I don't know how many of us are aware that currently we are negotiating a new convention or agreement or other instrument that is going to enable us to be more prepared for pandemics in the future. There is a WHO-led process where an intergovernmental negotiating body has been formed, and since last year, a lot of meetings are going on for us to be able to negotiate something like a treaty that is going to enable us to handle pandemics much better, to prevent the occurrence of pandemics, to better prepare for these pandemics, and even if they come, then we are going to respond in a much better way. And we have experienced the devastation that COVID-19 has visited on our health infrastructure. And so we are looking at ways in which we can even be better prepared to now recover from such pandemics in the future. And it is now a very important thing for us, all of us here as individuals, to ensure that we also take notice of what is happening in terms of the negotiations that are going on and contribute, because it is very important that the global health infrastructure that is going to emanate from these conversations is going to represent our situations from wherever we are. So it is very important that we take time and pay some attention to the ongoing conversations around pandemic preparedness and response. At the same time, as we negotiate this convention, agreement, or other instrument, which is a WHO-led process, we are also cognizant of the fact that the international health regulations that were put in place in 2005 did not serve us very well during the COVID-19 pandemic. We actually saw a lot of countries struggling with compliance to the IHR 2005. We saw a lot of countries grappling with implementation of the IHR 2005. And so, alongside the treaty negotiation process, we are also having a structured amendment process for the international health regulations, which is ongoing today. I don't know how many of us are aware of that ongoing process, by show of hands. You see, this is what I was telling you. Very few hands. Now, these are very consequential discussions. And I want to appeal, because we are very important stakeholders seated here, I want to appeal to each and every one of you to take time to understand what is going on and to identify how you can participate in the ongoing conversations, because each and every one of us has a role to play, very important role to play in these conversations. So, we really look forward to robust discussions around key areas such as public health emergency preparedness and response, vaccine preventable diseases, reproductive and child health, mental health, which is now becoming a very big problem, effects of climate change, as we have said before, public health system strengthening, and digital health technologies. These subjects are not just mere academic exercises. They are the building blocks of a healthier and more secure Africa. Now, a lot of the discussions which are lined up for, the topics that have been lined up for discussion in this conference, because we were having a discussion with my cabinet secretary, and we were looking at some of the topics that are lined up for discussion. And we actually realized that these topics harmonize perfectly with the Kenya health agenda, the one that I talked about, where we are looking at a bottom-up approach. Now, it is estimated that, and I was listening very carefully because I wanted to know the numbers. I looked around the room. At one point I was trying to count, but then it was very difficult. But it is estimated that over 700 participants from more than 40 countries are participating in this exercise. So you can imagine the kind of exchange of knowledge and experience that is going to happen within these 4 to 5 days that we are going to spend here. And we are inviting you to remain here, even after those 5 days. Don't go back home. Just stay here and enjoy the ambience of Mombasa, all right? And even if you get tired of Mombasa, there are other places like Amboseli where you can just go and see lions and other things, which are very good to you. So we are really looking forward to a lot of exchange of knowledge and experiences which are unique to us, which are going to help us to build our body of knowledge and to hone our interventions so that they are much more relevant to our priority public health problems. That is something that we really want to see. Even as we enjoy Mombasa, please, let us make sure that we come up with a lot of recommendations that have utility, that can help us to shape policy, that can help us to improve provision of healthcare services on the continent and beyond. It is something that we really hope to be able to see even after this. Furthermore, this conference is coming at a very crucial stage. We are just emerging from the COVID-19 pandemic. The other day in Kenya, we were grappling with the cholera outbreak. It is not yet even over. Yeah, polio, we have found some cases. There are quite a number of public health issues that we are looking at. We have seen Ebola outbreaks in our neighborhood, Marburg, you know, on the continent. Actually, the African continent is the one region in the world that is grappling with some of the most, you know, incidences of public health events. So we really need to look at how we are going to come up with customized solutions for these myriad of problems that we are facing in Africa. We are emerging from the COVID-19 pandemic. Have we started conducting after-action reviews? How many of us have started conducting after-action reviews for COVID-19? Don't be scared, just lift your hand high. It is a good thing. Wow, that is very good. Because I know most of us are waiting. We are waiting to see. Have others done it? Then now we can start. Let us start learning from the experiences that we have had. Because the COVID-19 pandemic was a very important experience that we need to learn from so that we prepare much better for the future, so that we can be able to identify where the gaps are. It is important that we do it, and we do it now. So one of the things that I'm really going to encourage is that we think about how we can be able to go in and carry out some of these very important processes. Now, as an individual, I usually have a bit of a problem when I see a big crowd of people and there's a microphone and a podium. So I'll try, I'll try to remember that we need to start. And I just want to really thank those who have been involved in arranging for this important meeting and coordinating the gathering that we are seeing here, very significant. AFENET is a very strategic institution or organization. If the circumstances were different, probably if I was born a bit earlier, I know I would have been a Pan-Africanist. Because one of the things I don't understand is when I look at the map of Africa, then I see a lot of lines, you know, inside the map. And then we are being told that this is a different country. So you'll find somebody like Alex is different because he's from another country. But when I look at him, he's just like me. You know, when I'm in Chad, I feel like I'm in the village at home. When I am in Botswana, like when we were there for the RC, WHO Regional Committee, you feel that you are at home. So I think we now need to start thinking beyond these borders. As AFENET, we really need to start thinking a bit. Let's put these borders away. You know? Let us not really focus a lot on these borders because they are just lines. The public health problems that we are facing here in Kenya, I can assure you, are exactly the same public health problems that my brother professor is facing in Ghana. In Uganda here, we are having a lot of the same thing. In Busia, you know, when you're in Busia, you just realize that you're already in Uganda, you know? So we cannot afford to start having this kind of fragmented agenda. And I think we are looking up to organizations like AFENET, organizations like the Africa CDC, you know, organizations, you know, Pan-African organizations, including even WHO, to be able to help us to now focus regionally to regional problems. So I really want to call upon the participants here to start having that, thinking along those lines. What are some of the problems? How can we address them using a regional approach, a continental approach. Yeah? So that one I'll not go too much into it, but then it is something that I really want us to look at. And even as we do that, let us really look at the involvement of each and every stakeholder. Because for public health problems, for public health issues, we cannot do them alone. We must reach out. It is a whole of society approach. So we need our partners, we need our stakeholders in the public sector as much as we need our partners in the private sector, as much as we need other players in other sectors outside of the health sector. So let's look at a whole of society approach to be able to address a lot of these issues. So Kenya is one of the 4 founding members of AFENET. Clap for us. I saw some, some elders being asked to stand, and they were clapped for. So I think by being one of the founder countries, we also deserve that. And we have been an integral partner in this mission for 2 decades. That's 20 years. This year, Kenya celebrates the 20th anniversary of uninterrupted enrollment in the Kenya Field Epidemiology and Laboratory Training Programs. That is the FELTEP. So for the other countries, what you do with that information is up to you. Okay? 20, just remember, 20 years of uninterrupted. Okay? So what you do, here in Kenya we say, iyo ni yako. Okay? That one is up to you. But I think we really need to support these important initiatives, like our field epidemiology training programs. In Kenya, we call it Field Epidemiology and Laboratory Training Program. And I'm happy to see our head of the program here, and they are doing a very good job at trying to ensure that we are meeting the WHO threshold. You know, we talked of workforce development as one of our pillars. Remember HRH? So there is a threshold that we need to meet so that we have 1 epidemiologist for every 200,000 population. And we are really trying to do that. Every year, we are making sure that we enroll about 20 residents every year. And we are very happy with the support we are getting from the Africa CDC, US CDC, and others to ensure that we keep on bringing this number to where it is supposed to be. But then when my brother from the board was saying that we really have to make sure the numbers are going up, we are having a problem because whenever we bring these epidemiologists out, they are gone. I don't know, they are like hot cake, you know? The moment they just step out, they are gone. Then again, we start from square zero. So we really have to look at how we can play around with the numbers so that we produce enough epidemiologists for the market, not just for ourselves, okay? The demand is very high. So we really need to work on making sure that we get this together. So as we stand in 2023, AFENET's reach has extended across the continent, boasting a membership that spans 40 countries. Since its inception, AFENET has convened biennial scientific conferences in 7 African nations, okay? Including Ghana, Uganda, Kenya, Tanzania, Ethiopia, Nigeria, and Mozambique. These conferences serve as critical Pan-African platforms where experts deliberate on effective strategies to strengthen epidemic preparedness and response, and to tackle various public health challenges. So there's a time when we had a meeting and one of the guests actually said that he had left his speech, and it was a presidential meeting, you know? That's why we usually say that we try to make sure that we don't depend too much on the speeches, but we share what we have. So for me, I just want to say that it is not just for me alone, but on behalf of our Cabinet Secretary, the Ministry of Health, and you know, everybody else within Kenya. We are very happy to have you here, and we want you to feel welcome. We are looking forward to the deliberations that are going to happen in this meeting, because we know that whatever comes out is very important, and we are ready to leverage the discussions to be able to improve on delivery of public health care. Now, at this juncture, I wish to now finish by wishing you very productive deliberations, and to wish you all the best. Enjoy yourselves in the next week, so that you can be able to have a memorable experience in Kenya. Thank you very much. Asanteni sana. And at this moment, I wish, it is my humble duty and honor to declare the 8th conference of AFENET officially open. Thank you very much.
Thank you so much, our chief guest, Deputy Director Asanteni Sana. At this point, I'd like to invite all my speakers on the panel, if you could just be upstanding for a group photo. If it wasn't photographed, it never happened, yeah? Dr. Boru, please join us on stage. Okay. So we shall smile. Are we smiling? Okay. Okay, before you leave, there's another set. I would like to invite our dignitaries also to join us upstage. Can we all fit upstage, or do we need people? Okay, at the front. Okay, okay. So my speakers will remain on the stage, and our guests will be up front here. Okay, looking good, looking good. Let's be animated, let's smile. Let's see those happy smiles. Okay, great. I'll keep my speakers up on stage, and I'd like to invite the founders and board members who are here to kindly join us on stage for a photo. The founders, if you could make your way, thank you so much. Right in front here. Yeah. All right. How does that look? We still have just 2 more to go. Let's smile, guys. All right, great. So my speakers will remain on stage. The next photo will be the board and management. The board and management. My speakers, you'll be in many, many photos, so keep smiling. So the next photo will be the board and management. Okay, because I'm getting another instruction from the, what is his name, the guy in green? Okay, are we done with that final photo? Program directors. Let's have the program directors. Final photo. I'm sorry, you've taken too many photos today. Program directors. All right, ladies and gentlemen, thank you very much. Please take to your seats for just a quick set of instructions, and then we'll be able to break. Thank you, ladies and gentlemen, for sitting through this and for your indulgence and your participation in this process. Thank you to all our speakers for your reaffirmed commitments in being part of this. But more importantly, also thank you, AFENET, for putting such a fantastic set of conversations. So ladies and gentlemen, I know we've been seated for a very, very long time. We're about to change that. So here's what we'll do. We'll be breaking for tea in a moment. But I'd like to give you just a quick guide of where you'll be after this, okay? So once we go for tea break, we shall reconvene here for plenary number 2 on your programs, okay? Are we clear up to there? So go for your tea break, and then we reconvene here for plenary number 2. After plenary number 2, I know there's lots of people who've already booked what rooms they want to attend. I will mention this here, but I will also repeat it later on. But for your planning purposes, if you are taking, thank you. If you are taking room 1, it's called Shimba. Room 2 is called Dodori, and room 3 is called Boni. They're all downstairs. Okay? So room 1, 2, and 3 are all downstairs. Room 4 is called Mwangea. It is on the left as you exit this hall, on the left. All right? If you get lost for whatever reason, our ushers will be there to guide you. But I repeat, room 1, 2, and 3 are downstairs. Room 4 is on the left. We'll take a break into tea and reconvene here for plenary 2. After plenary 2, we will be able to then go into our breakout sessions. Also, just to let you know and request you, if you could kindly leave your translation devices on your seats. Whichever rooms you'll be going for will be provided there, so you do not need to carry it. Please leave it. They will reset it for the next session. Is that okay? Tea is served right outside on our right. Please enjoy. Let's reconvene. Thank you so much.